there were multiple assumptions about what digital health could do, and multiple ways in which adaptations occurred over the last 2 months. And so I wanted to explore some of that because some of the assumptions have not proved to be true, and others have proved to be true. So, Lee, do you want to take an initial pass at looking at what those assumptions were and how people have adapted?
Yeah, thank you, David. I think we had some assumptions, and they were probably really prejudices or biases. For example, that older people wouldn't accommodate to video conferencing. They wouldn't be able to handle the technology, or that people who spoke a different language than English couldn't be served. I'm fond of saying if my 85-year-old mother can do Pilates over Zoom, we can do virtual visits with many of our patients. I think what we have to recognize is that we were caught unprepared. So I think we have to really explore those assumptions, and as Alistair alluded to, put extra effort into the navigators and the community health workers and whatever we have in society that we can leverage to get our patients comfortable on a digital platform so that we can deliver the care they need through these crises.
Thanks, Lee. Maybe Brooke, could you also comment on some of the ways in which digital healthcare can address some of the inequity issues?
Sure, absolutely. And Lee, I really appreciate everything you said. And this crisis certainly has pointed out the stark inequities that exist. And I think as we look towards adapting and launching new ways of delivering care, we really have to look to eliminate those inequities that have existed for too long and take a real thoughtful approach to questions like how can telehealth really benefit all of society. So, ask ourselves the questions like, can we use telehealth to enable expanded networks, to connect patients to providers that not only understand my mental and my physical needs, but also my cultural needs? So I think there's just a lot of potential for us here to make a really positive change if we approach this new chapter with a mindfulness of issues like this.